Status quo in women's health. Well, women wait on average 4 years longer for a diagnosis of the same disease as men. Women receive pain medication on average 16 minutes later in emergency room settings because women tend to be disbelieved and seen as hysterical when they're in pain. Women experience worse side effects from medication in 90% of cases because they were excluded from clinical trials in the US until 1993. There's twice as much investment into male prevalent diseases, which obviously impacts what therapies are developed. And for every one woman diagnosed with a women's health condition, roughly 4 go undiagnosed versus only 1.5 for men. Yeah, so basically to sum up that slide, women's health is under-researched, under-invested, and under-taught in medicine. But we're at Mariantix's AI campus. So today has a theme, and that's AI in women's health. There's been a lot of talk around ChatGPT and OpenAI and how that's going to totally disrupt and revolutionize healthcare. And I think it definitely has a lot of exciting possibilities. But if we look at the status quo in women's health of it being underinvested, under-researched, and under-taught in medicine, if you're creating solutions and there's no data to base it off of, what might the outcome be? So the NIH piloted AI to diagnose liver disease, and what they found was that it performed with 70% success rate, which is not bad. But when they looked at who cases were missed, in 44% of the cases it was women versus 23% among men. So obviously we see that there's like quite a large discrepancy. But we want to be optimistic, and so because the theme of today is digital solutions for innovating in women's health. And so is it also possible that AI could pave a path to a better, brighter future? If we start looking at which data sets are missing, which data sets we need to collect, are there effective ways to incorporate that finding into clinical practice and corporate settings? Could AI actually be used to accelerate equity in healthcare instead of causing the gap to become dramatically wider? And so that's sort of the lens of today. Could AI and digital solutions help improve women's health?